Hello everyone and welcome to today's discussion over lung volumes and capacities and their importance in a pulmonary functional test. We will begin by talking about what a pulmonary functional test is. We will then discuss each lung volume and capacity separately and explain what each represent and why they are important. Then, once we have a better understanding of the material, we will discuss what conditions can alter these volumes and how they affect the individual. If you are ready, let's begin. Pulmonary function tests are a testing measure used by physicians to evaluate the respiratory function of their patients. The problem with these tests is the results produced are dependent of the patient's effort and participation. However, they are still considered to be accurate and reproducible. They are used in conjunction with the patient's medical history, physical examination, and laboratory data to develop a diagnosis. These tests are also conducted to check the status of an existing pulmonary disease and assess whether current treatment is being effective. A pulmonary function test is most commonly conducted through the process of spirometry, which is the method we will focus on in this discussion. Spirometry is a physiological screening test of general respiratory health that measures the individual's ability to inhale and exhale in relation to time. During this test, the individual is asked to breathe through a tube that analyzes the volumes of air being pulled into the lungs and those being expelled. The volumes are recorded in a graph known as a spirogram. Inspiration in this spirogram is recorded as an upward deflection, while expiration is recorded as a downward deflection. These deflections are then analyzed to determine the respective lung volumes and lung capacities of the individual. These we will discuss next. We will begin with tidal volume. Tidal volume is the volume of air that is being transported into and out of the lungs during each respiratory cycle, or each breath. This volume is extremely important in a clinical setting in which an individual requires mechanical ventilation. It is used to ensure that the patient is receiving adequate ventilation without causing trauma to the lungs. It also plays an important role in the calculation of minute ventilation, which is the volume of gas exchanged per minute and is calculated by multiplying the tidal volume by the respiratory rate. The average tidal volume in a healthy male individual is 500 milliliters. This number is slightly smaller in females, measuring approximately 400 milliliters. Next, we look at inspiratory reserve volume. This is the extra volume of air that the lungs can inhale when inspiration is maximal. This maximal inspiration is accomplished with the external intercostal muscles and the accessory inspiratory muscles, as well as the maximal contraction of the diaphragm. The tidal volume is not included in this measurement. This measurement in a healthy individual is approximately 3,000 milliliters. By adding together the tidal volume and the inspiratory reserve volume, we get the inspiratory capacity. This is defined as the maximal volume of air that an individual can inspire at the end of normal quiet expiration. So, if we look at our healthy male and females mentioned earlier, the male would have an inspiratory reserve volume of around 3,500 milliliters, and the females would be roughly 3,400 milliliters. Now that we have covered the volumes and capacities that pertain specifically to inspiration, let us switch gears and discuss those related to expiration. When an individual engages in physical activity, respiration increases in relation to the increased need of oxygen. An individual breathes in deeper during exercise and therefore must be able to exhale this extra air. This extra air that is expired with the help of the expiratory muscles maximally contracting is called the expiratory reserve volume. The average value of this measurement in a healthy individual is 1,000 milliliters. When we maximally expire, there is still a volume of air that remains in the lungs. This volume is called the residual volume. This volume cannot be measured in the use of a spirometer because of the fact that it does not move in and out of the lungs. It is measured in an indirect manner through gas dilution techniques. During these techniques, the individual inspires a known quantity of a harmless tracer gas, and then physicians measure the dilution that occurs. The average volume for residual volume is 1,200 milliliters. By adding together the expiratory reserve volume and the residual volume, we are able to calculate the functional residual capacity. This is the volume of air that remains in the lungs after a normal passive expiration. It is achieved as a result of the net compliance of the lungs. The average functional residual capacity for a healthy individual is 2,200 milliliters. Moving along in our discussion of volumes and capacities, we come to the vital capacity. This is the maximal amount of air that can be expired during a single breath following a maximal inspiration. It is calculated by adding together the inspiratory reserve volume, tidal volume, and the expiratory reserve volume. The vital capacity is used to represent the maximum volume change that can occur in the lungs and is a valuable measurement in determining the lungs' functional capacity. However, it is rarely used due to exhaustion of the muscles used during maximal contraction. The average measurement of vital capacity is 4,500 milliliters. The final lung capacity we are going to talk about in this brief lecture is the total lung capacity. This is the maximum amount of air that the lungs are capable of holding. The average volume in a healthy individual is 5,700 milliliters. Now that we have a better knowledge of the lung volumes and capacities, let's take a look at conditions that affect them. There are two classifications of lung diseases we will briefly discuss: restrictive and obstructive. A restrictive lung disease makes filling the lungs a difficult task by reducing the ability of the lungs to expand. This results in a reduced lung volume with a low total lung capacity. One form of restrictive lung disease is interstitial lung disease. Individuals with this condition have a lower compliance between the lungs and chest wall, which increases the tendency of the lungs collapsing. To balance the forces opposing on the lung, the functional residual capacity decreases. Other conditions that can lead to restriction of the lungs include muscular dystrophy, polio, scoliosis, and morbid obesity. Next, we look at obstructive lung diseases, which are characterized as difficulty in emptying the lungs. When the airways become obstructed, the pathway of air leaving the lungs may halt earlier than expected, leading to air being trapped in the lungs. The compliance of the lungs and chest wall can be normal or elevated with these diseases. The functional residual capacity is also reduced to create balance. Two common categories of obstructive lung disease are asthma and COPD. People with asthma present with the following: dyspnea, a cough, wheezing, tachypnea, which is abnormal rapid breathing, and a deficiency of oxygen in the blood called hypoxemia. It is characterized as possessing hypersensitive bronchi. COPD can be characterized into two conditions: chronic bronchitis and emphysema. Individuals with chronic bronchitis have hyperplasia and hypertrophy of the glands that secrete mucus in the bronchi. They present with dyspnea, wheezing, cyanosis, which is a bluish hue of the skin, and CO2 retention. Individuals with emphysema have a barrel-shaped chest and typically breathe with pursed lips to increase pressure in their airways and prevent the likelihood of collapse of the alveolar walls. The most common risk factor of developing this condition is smoking. Smoking leads to the loss of elastin fibers in the lungs and increases lung compliance. And that concludes our discussion today over lung volumes and capacities. These measurements are important in determining the health and functionality of our lungs. When the health of our lungs deteriorates, so do these values. I think everyone's goal is to be like the healthy individuals mentioned throughout the presentation. And although that cannot always be the case, it is important we monitor our health and take care of ourselves. I hope that you found this video informative. And as always, I wish you good luck in the rest of your studies and have a wonderful day.